According to antenatal care, ideal number of antenatal visits, focus on the number. Ideal. Just a just a second. Yes. Just a second, please. Yes. Whenever there is ideal number, we should go for 12 to 14. First 7 months, 7 visits. 8 months, 2 visits. 9 months onwards, once every week. So 7 plus 2 plus 4 to 5. 13 to 14 visits. If you are asked about their minimum visits, 4 according to RCH program, 8 according to WHO. But only if they ask you minimum word in that. Postnatal visits are undertaken by multi-purpose worker females separately, ASHA workers separately. So multi-purpose worker female ANM, they take 3 to 4 visits. ASHA worker undertakes 6 to 7 visits. 3 visits are day 3, 7, 42. Home visit, additional visit on day 1. In ASHA visits, institutional visits are day 3, 7, 14, 21, 28, 42. In home visit, additional visit on day 1. ASHA, when she is taking the visit, that is known as program name home-based newborn care. Home-based newborn care. All visits have to finish by 42 days because most common cause of maternal mortality, postpartum hemorrhage. Maternal definition of maternal death include up to 48 days, right? Days, multiple readings you'll have to give. Almost every student is writing correctly, friends, so we have to. This is what one of the students was asking earlier. Maternal death per 1,000 women in reproductive age. This is. What is the answer, friends? Choice number C. In ratio, it is per 1 lakh live birth. So ratio is more commonly used per 1 lakh live births. Rate is per 1 lakh women in reproductive age group. All the MCH indicators, common denominator is live birth. Can I say all of them have same multiplier also? No. All of them have multiplier 1000 except MMR, which we have discussed, has a multiplier of 1 lakh. Can you tell me the most common cause? Which of them? The most common cause is low birth weight, prematurity. Low birth weight and prematurity, single answer prematurity, is the commonest cause of which of them? It is the commonest cause of infant deaths also, under 5 also, neonatal also, perinatal also. MMR is through PPH. Direct PPH, indirect anemia, still birth rate, maternal infections, abruptio placentae. Maternal infections, abruptio placentae. Then let us look at latest question. Best indicator to determine health status, health services utilization effectiveness. 4 older questions of your exam, they mixed into a single question, IMR. This is the best place to mix everything now. When we look at health services availability, IMR, health services utilization, effectiveness, health status, state failure, ASHA. All the 6 questions, answer is infant mortality rate. Socioeconomic development. Can you tell me, friends, which is the best indicator? I'm looking at the chat box. Yes, Dr. Pranjal, Dr. Rupali, you are right. Under 5 mortality rate. Under 5 mortality rate when we are looking at socio-economic development or social development. Right? So please be careful while marking this answer. Combined maternal newborn care. This is perinatal. All of us know perinatal is 28 weeks till 7 days. So both parts are included, maternal newborn. Cost effectiveness of a health program is Kelly. These 5 we have discussed, I skip. Virulence or killing power, case fatality rate, Which disease has 100% case fatality? Which disease? Dr. Anuj is right. Dr. Mangesh Kumar Gupta is right. Which disease has 100% case fatality? Rabies. Communicability, secondary attack rate. Communicability of a disease is given by secondary attack rate. Now the calculation question. Neonatal mortality rate is given by the formula neonatal death upon live birth into 1000. When we look at the question, look at the live births, 4050 total and 50 are stillbirth. So 4050 total deaths minus stillbirth. Total live births are 4000. Then they're asking numerator 0 to 7 days, 8 to 20 days. Neonatal period is 0 to 28. Early plus late into 1000. So 200 upon 4000 into 1000. Answer is 50. This is the exact question of your paper. We have to mark it correctly, friends. Read the values carefully. Similarly, let us calculate ratio here. Maternal death upon live birth into 1 lakh. When we look at live birth, 4000. Multiplier we know. Only thing is you have to calculate numerator correctly. So 2 obstructed labor, 1 shock, 1 PPH, 4 deaths. Snake bite electrocution are not related to maternity or its complication. That will not be included. So only when death occurs due to pregnancy or its complication, answer will be 100 per 1 lakh live births. This we have to remember. FIMNCI, 2 questions. Which age group and which 5 diseases? Age group is 0 to 5 years. 5 diseases are diarrhea, pneumonia, malaria, measles, malnutrition. RBSK, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. Target beneficiary and diseases covered. Target beneficiary is child 0 to 18 years and 4 Ds. Diseases, deficiency, defect, disability, developmental delays. Total 32 diseases are covered under this. राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम. It is Kishore, adolescent, age group 10 to 19 years, having 7 C's. Any one of you who feel you remember all the 7 C's. We have discussed in detail in lab 1 also, revision in lab 2 also. Clinic, community, communication, content, convergence, coverage and counseling. Multiple readings we have to give. NSSK, Navjat Shishu Suraksha Karikram. This is a training program for healthcare people. Nutritional Rehabilitation Center. It is for below 5 years severe acute malnutrition. HBNC is postnatal visits by ASHA. Facility based newborn care, where we construct NBCC, NBSU, SNCU. Facility based newborn care, right? Okay. Birth weight. Can you tell me what is low birth weight, very low birth weight, extremely low birth weight? This is less than 2.5 kilogram on day of delivery, less than 1.5, less than 1. Moderately low birth weight is in between. Birth weight doubles in 5 months, triples in 1 year. Prevalence in India is 18.7%. 18.7%. Preterm in India is less than 36 weeks. They are always going to be low birth weight. Term is 37 to 42. Postterm is more than 42. By chance, if they are low birth weight, this is the definition of small for gestational age, small for date babies. It does not include preterm low birth weight. Most common cause IUGR, percentile definition of weight for gestational age less than 10%. Identify first and second instrument. First is Salter scale, birth weight or infant's weight. Second is infantometer, birth length or height we can measure. Exclusive breastfeeding is done till 6 months of age, continue till 2 years. Immunoglobulin most abundant in breast milk is secretory A, followed by D, followed by other types. Essential fatty acid exclusive to breast milk is docosahexaenoic acid. Vitamin most deficient in breast milk, we have discussed. There is no controversy. Vitamin D, followed by K, followed by B. Energy 65 kilocalories in 100 ml. Protein is 0.9 to 1.1 gram per 100 ml. Human milk is rich in, anyone remembers which nutrients human milk is rich in? Lactose, iron, water, calcium phosphorus ratio. Cow's milk is rich in protein, fats, energy, and individual amount of calcium phosphorus. Breastfeeding should be started after a normal vaginal delivery as soon as possible, but maximum within 1 hour, preferably at the delivery table. Caesarean section as soon as possible again. Not in the choice, then maximum within 4 hours. This we have to remember. Good. Wasting is which of them? Take your time. Wait for age, wait for height, height for age. Wasting. This represents acute malnutrition. Lesser height for age. Stunting. This represents chronic malnutrition. And if there is lesser weight for age, underweight, that represents acute on chronic malnutrition. Acute on chronic malnutrition. So these three we have to know, mark them correctly in the paper also, friends. So wasting and stunting. WHO growth chart, David Morley developed growth charts drawn between weight and age. Uppermost line is equal to, only one question. NCHS standards, uppermost line is 90th percentile of boys, no. It is 50th percentile of boys. Lower line, 2 standard deviations below, is 3rd percentile of girls. In between, this is road to health. Green area is road to health, NCHS. Only 4 IQ levels you have to tell me. Lowest IQ, idiot 0 to 24, imbecile 25 to 49, 50 to 69 is moron. We are only looking at your exam questions. Now, when you look beyond politicians, then normal suddenly becomes 90 to 109. In mental retardation classification is an exception where normal IQ is taken more than 70. 50 to 69 mild, 35 to 49 moderate, 21 to 34 severe, less than 20 profound. Mental retardation classification also you have to remember. This is ICDS. What is S here? This is midday meal program. Integrated child development. S is not scheme or strategy. It is services. Integrated child development services. This is covered under Ministry of Women and Child Development. We have children below 6 years, 1 beneficiary. Total 4 beneficiaries are there. We have non-pregnant, non-lactating, reproductive age group female, pregnant lactating female, and 11 to 18-year adolescent girls. Except adult male, everyone is important. Then one community development block comprises of 100 villages, 1 lakh population. Heart of ICDS is Anganwadi. So heart of ICDS is Anganwadi. How much calories, how much proteins? In both the scheme, it is same actually. 1/3 calorie, 1/2 protein. Same here also. But here the ministry is Ministry of Education. Earlier HRD, now Ministry of Education it is converted to. 5 days you have to maintain your flight. Please remember 5 days, there should be nothing stopping you. Take sleep in 5 days also, so that on the exam morning you are fresh. It's not that 5 days you don't have to sleep, right? PYQs late night, keep on doing, keep on doing.